Okay, that familiar ache, we all know it, right?
Mm.
Maybe it's a dull throb sort of settling behind your eyes,
Mm-hmm.
or sometimes it's that sharp, piercing pain that seems to just come out of nowhere,
Mm-hmm.
or even just a constant pressure making it hard to focus.
Yeah, absolutely.
And how often do we just, try to push through, reach for a quick fix, maybe some pills, and just label it, oh, it's just a headache or it's a migraine.
Right. Slap a label on it.
Exactly.
Yeah.
But what if that ache is more than just a nuisance? What if your body is actually trying to tell you something, something deeper?
That's the core question.
So today, on the deep dive, our mission is, well, to go beyond the surface of these really common complaints. We're talking headaches, migraines, cephalalgias, those more general head pains.
Oh,
We want to explore why truly understanding the root cause is so crucial. Not just for temporary relief, right? But for finding effective, natural, and hopefully lasting solutions.
yes, getting to the bottom of it.
We've pulled together some really fascinating insights from the sources you've provided us, and, well, we're ready to dig in.
That's right. And what often gets just tossed into the category of chronic pain, it might simply be an untreated signal, a misunderstood message from your body.
A message, okay.
Yeah, and our goal today is really to help you learn how to interpret these signals correctly so you can move past those labels and work towards genuine resolution.
Okay, let's start right there then. You said chronic pain might just be a misunderstood message. How do we even begin to unpack that?
Well,
Like, for someone listening who's been told, oh, your headache is just chronic, what's the first big misconception we need to tackle?
I think the biggest misconception is thinking a headache is just a headache. Like it exists in isolation, right?
Right.
What's really fascinating when you look at the research is just how many different types of head pain there are. And crucially, how similar some of them can feel, how they manifest. It's not just some generic ache. So we absolutely need to differentiate. Is it a general head pain or is it something more specific, like a migraine? Our sources point out, for example, a really specific challenge. Trying to tell the difference between, say, a cluster headache and something called Arnold's suboccipital neuralgia.
Arnold's. Okay, that sounds specific.
It is, and they can both present with this incredibly intense, almost unbearable pain. So to you, the person experiencing it, they feel remarkably similar.
Wow.
But their origins, where they're actually coming from, completely different.
And sometimes it's not even that intense pain, right? It's that other sensation, that feeling like your head is being squeezed
Yeah.
from the outside in.
Yes, that embotamiento feeling, like a pressure closing in. A very particular kind of pressure, almost like a clamp or a vice.
Yeah. And speaking of specific sensations, what about ringing in the ears, tinnitus? Have you ever had that, seem to go hand in hand with your head pain?
That's a common connection.
Or maybe blurred vision.
Yeah.
Or irritation in your eyes. The point is, these aren't always separate issues, are they?
Not at all. They can all be part of the same complex picture your body's painting, all connected somehow back to that head pain.
Okay, now this is where, for me at least, it gets really interesting and maybe a bit surprising for some listeners.
Yeah.
Sometimes the root cause isn't even in your head.
Exactly. That's a huge point. If we connect this to the bigger picture, the whole system,
Yeah.
we often see headaches are, well, a manifestation of something broader, a systemic issue.
Like what? Give us an example.
Okay, think about your neck, your cervical spine.
Right.
Problems right there. I mean, even something seemingly simple, like you mentioned, an unsupportive pillow or maybe an old mattress,
Uh-huh.
those can be direct contributors to head pain, but the connections go even deeper, much deeper, actually.
Deeper how?
Well, our sources talk about some, frankly, profound metabolic surprises. For instance, issues in organs like your liver.
Your liver
Yeah.
causing headache.
Yes. Seriously. Maybe it's fatty liver, or maybe just poor dietary habits causing irritation. There's actually a specialized nerve network, the Gleason's capsule, connected right up to the D2C2C3 region in your neck.
Wow.
So liver stress can genuinely necessarily generate a headache, and it doesn't stop there.
Yeah.
The same goes for issues with your pancreas, your stomach, or even an imbalance in your gut microbiome, what we call dysbiosis.
Dysbiosis, like unhealthy gut bacteria.
Precisely. These internal imbalances can be direct drivers of head pain. It's quite something.
That is a powerful idea. Pain not being where it seems. But I imagine for many people listening, it's hard to accept that, say, a problem in their liver or gut could really cause head pain. What's the barrier there?
I think the biggest hurdle is often the lack of direct, immediate sensation in those internal organs. You don't really feel your liver being irritated in the same way you feel, I don't know, a stubbed toe.
Right, makes sense.
But the body has these incredibly intricate communication pathways. The gut-brain connection, for instance, it's profound, especially via your stomach and the vagus nerve.
The vagus nerve, okay.
Yeah, so if your stomach acidity is off, that's a chemical issue, right?
Hmm.
Or maybe you're under chronic stress. Your fight or flight system is stuck on high alert, what they call sympaticatonia.
Okay.
While your digestion suffers, that can then cause dysbiosis, the unhealthy gut we mentioned, and then toxins from that unhealthy gut can leak into your bloodstream, a condition sometimes called endotoxemia.
Endotoxemia. That sounds bad.
It's not great. And these things cascade. They lead to various metabolic disorders and ultimately, yes, headaches. It's a whole body chain reaction.
Wow. Okay.
And, this cascade also helps explain that common advice, oh, just drink more water for your headache.
Right. I hear that all the time.
And hydration is vital, don't get me wrong. But simply drinking more water often doesn't fix the pain if these deeper metabolic and systemic issues aren't addressed. You're putting a Band-Aid on a deeper problem.
Okay. What about fasting headaches? Some people get them after, say, 14 or 16 hours without food. What's going on there?
Ah, yes. Another fascinating connection. Our sources explain it really well. It often comes down to something called metabolic rigidity.
Rigidity.
Yeah. It means your brain primarily relies on glucose, sugar for fuel. But if you have metabolic flexibility, your brain can easily switch gears. It can use alternative fuels like ketones when glucose isn't around.
Ketones.
Like from fat burning?
Exactly. So getting a headache when you fast, it's often a sign that your metabolism isn't very flexible. It needs some attention, maybe through diet, maybe exercise, to become better at switching fuel sources.
So tying this all together, what if your headaches aren't just random pain? What if they're actually signals, clues, testimonies even?
That's a great way to put it. Testimonies.
Clues to what's happening elsewhere in your body, trying to send you a message.
Precisely. Your body's trying to communicate.
Okay, so now that we understand kind of the surprising breadth of where headaches can originate, let's try and become detectives ourselves. How can you, listening now, learn to read the specific clues, the patterns in each type of head pain?
Good question.
You mentioned that distinct squeezing sensation earlier, that embotamiento. Let's start there. What are the key giveaways for that specific kind of head pressure?
Right, that squeezing from the outside in feeling. It is quite distinct. Our sources specifically link this to things like persistent stress, unresolved problems maybe weighing on your mind, elevated cortisol levels, that's your main stress hormone, disrupted circadian rhythms, your internal body clock being off, and crucially, poor sleep cycles.
Sleep always comes back to sleep.
It really does. Essentially, if you're not getting truly restorative deep sleep and your body is kind of stuck in that constant state of alert, this kind of head pressure can manifest. It's often the brain reacting to chronic systemic strain.
Okay, makes sense. Then there's the big one, the migraine. How does that typically show up? How is it different?
A migraine, yeah, that's often described very differently, more like an internal pain, like an exploding head feeling almost from the inside out.
Inside out, okay.
It's frequently bilateral, meaning on both sides of the head, though not always. And it can be incredibly debilitating, as anyone who gets them knows. Our sources suggest a strong connection to the hypothalamus. That's like the brain's master control center for hormones, sleep, appetite, temperature.
Right.
And they even mention that chronic energy demands, maybe stemming from experiences way back, even early childhood, can play a role in setting the stage for migraines later. It's like a profound disturbance in the brain's core regulatory systems.
That's deep. Okay, what about a more general head pain? What doctors might just call a cephalalgia.
Right, a general cephalalgia. That commonly shows up as pain on just one side of the face or head,
Yeah,
often kind of localized around the eye.
one side around the eye.
Yeah. And this can sometimes come along with other symptoms like rhinitis, a runny nose, or a nasal drip, or even eye tearing, often, interestingly, in the right eye specifically.
The right eye. Huh.
Yeah, and it's really vital here to differentiate this from that Arnold's neuralgia we mentioned earlier, because while they might share some symptoms, like that one-sidedness, their origins, and critically, their treatments are quite different.
Okay, so let's talk about Arnold's suboccipital neuralgia again. It sounds like a mouthful, but you said the pain is intense. What makes it so distinct? And you said often frightening.
It is. Arnold's neuralgia is definitely distinct and, yeah, often quite frightening for people. The pain typically ascends. It starts at the back of the head, the occipital region.
Base of the skull.
Exactly. And it travels up, covering one side of the scalp, often going all the way to the eyebrow on that side. And the sensation is often described as stabbing, sharp, almost like the eye is being poked hard from the inside out.
Oof. That sounds awful.
It's incredibly intense, and because of that intensity, it very often sends people rushing straight to the emergency room. They think something terrible is happening in their brain.
Understandable.
But then, the scans, MRI, CT scans, they come back completely normal, clear.
And that's because... Remind us why the scans are clear.
It's crucial. The scans are clear because it's not actually a problem within the brain itself. It's a nerve issue. Specifically, it's a pinched nerve.
A pinched nerve causing that much pain.
Yes. It's the nerve that comes out from the second cervical space, C2, right there at the base of your skull. That nerve gets compressed.
What compresses it?
It can be due to a dysfunction in the joints there, maybe a blockage or some kind of compensation pattern, often involving muscular or myofascial issues, basically. Really tight, strained muscles, or maybe misalignments in the upper neck.
Right.
And that compression then triggers that intense stabbing pain that shoots all the way up the scalp and feels like it's going into the eye. So getting the diagnosis right, and more importantly, finding effective treatment, it really requires the skilled hands of a professional, someone who deeply understands anatomy and how the body's mechanics, especially in the neck, actually work.
Right, you need someone who knows what they're feeling for.
Precisely. Now, this whole discussion raises an important question, doesn't it? Is it always absolutely essential to put a precise name, a specific label, on every single headache?
Good point.
While getting a formal diagnosis can be useful sometimes, our sources highlight that it can also be a bit, well, restrictive or even stigmatizing. And if the diagnosis is wrong, it can lead us down completely the wrong therapeutic path.
Wasting time and energy.
Exactly. So the suggestion is that the true focus should always be on understanding the underlying origin of the pain. Where is it really coming from, rather than just getting stuck on the label for the symptom?
That makes a lot of sense. So, okay, bringing it all together, what does this mean for you, listening right now? How do we move from just, popping pills or managing symptoms to truly resolving these pains by getting at their root causes?
Well, it really calls for what we'd term an integrative functional approach, and that means starting with a truly comprehensive treatment plan.
Okay, what does that look like?
First off, it means assessing your structural health. Looking closely at the movement of your cranial bones, how they relate to the occipital bone at the back of your skull, and that key head-neck junction, the C0, C1, C2 area, the cervico-occipital triad.
Right, the physical structure.
Then, crucially, we have to look at your organ health. And I know we've mentioned it, but we really cannot overstate the critical role of the liver here.
Okay.
Our sources are emphatic. If the liver functions poorly, all other treatments may fail. It's just that foundational to overall health and detoxification.
Wow. Okay, liver health is key. What else?
Beyond that, your body's biomechanics are absolutely vital. Things like blockages, maybe compensations from old injuries you forgot about, or even arthritic changes in the spine. These can actually compress the arteries, the vertebral or basilar arteries that supply blood and, therefore, oxygen to your brain.
Oh, interrupting blood flow.
Yes. And that doesn't just cause pain. It can also lead to symptoms like dizziness, a feeling of instability, even vertigo. And remember those sensory connections we talked about. Irritated vision, tinnitus, the ringing in the ears. They're often just extensions of these head and neck structural problems. They're not usually separate issues to be treated in isolation.
Right, it's all connected.
And finally, perhaps most importantly for the brain itself, sleep. Restorative, deep sleep. It is the only time the brain can truly detoxify itself, clear out metabolic waste, and re-nourish its cells. Superficial, light sleep, it just won't cut it for this vital repair process.
Absolutely. Deep sleep is non-negotiable. And this holistic view, it naturally folds in those other lifestyle pillars, doesn't it? Like a thoughtful, supportive diet, making sure you get regular contact with nature, having effective ways to manage stress, and of course, consistent physical exercise.
Exactly. These aren't just nice to haves. They are integral parts of resolving these complex pains. They support the whole system.
They really are.
And it's also why finding the right professional is so important. Someone who can genuinely see the whole picture, who doesn't just look at the headache, but looks, further afield.
What does that look like in practice?
It means someone who can read your blood tests functionally. Not just looking if you're in the normal range, but looking at optimal levels.
Right.
Checking glucose, your long-term blood sugar control, like glycated hemoglobin, lipid values, key inflammatory markers.
Okay.
Using all that information to provide a truly comprehensive, functional, and integrative diagnosis. And from there, Various therapeutic avenues can be explored.
Like what kind of therapies?
Well, it could be hands-on manual treatment to address those structural issues in the neck or cranium. It might involve targeted therapies, maybe nutritional or herbal to support organ function like the liver. Sometimes things like ozonotherapy or specific intravenous or intramuscular nutrient serums might be helpful, but it's always tailored.
Tailored to the individual.
Exactly, tailored to your unique underlying cause, not just the headache label.
Okay, so thinking about everything we've covered today, all these connections, these different types of pain, the systemic links, what stands out to you listening? What might be a potential area to explore further in your own health journey? What message could your body be trying to send with those headaches?
It gives you a lot to think about.
It really does. What a deep dive.
Yeah.
We've really journeyed, haven't we? From just experiencing a headache as, an annoyance to understanding this incredibly intricate network of systems, stress, digestion, neck alignment, metabolic flexibility, all potentially contributing to head pain. It's so much more complex and so much more interconnected than just a simple ache in the head.
And that really is the true takeaway, I think. Knowledge is powerful, but it's most valuable when it's understood and crucially when it's applied.
Right.
Your headaches, they're likely not just some random affliction that you're unlucky enough to have. They're probably, as you said, a testimony, a powerful indicator of what your body is trying to communicate to you.
Listening to the signals.
Yes. Learning to read those messages, to understand that language, that's the first vital step towards finding true, lasting resolution.
So maybe a final thought for everyone listening. Consider how often you just label a symptom, headache, fatigue, whatever it is, versus how often you truly stop and question its underlying story. What's behind it? What other chronic issues in your life might actually be telling you a deeper truth, just waiting for you to listen, investigate, and understand?